At 6 in the morning, Thomas, a 74-year-old patient of mine, woke up feeling completely fine. Better than fine, actually. He told his wife he felt great. By 8:45 that same morning, paramedics were rushing him into my emergency unit. His wife was in the waiting room, shaking, holding a cup of coffee she hadn't touched. When I reviewed his case, after ruling out every obvious cause, I found something that stopped me cold. Thomas hadn't eaten anything dangerous. His medications were perfectly managed. He had no hidden infection, no blocked artery we'd missed. What triggered his cardiac collapse was a habit. A 45-second habit he performed every single morning without a second thought. A habit that millions of people over the age of 60 repeat every day right now, completely unaware that it is quietly loading a gun aimed directly at their heart. I'm going to tell you exactly what that habit is. Not to frighten you, but because this information could be the difference between a normal Tuesday and the worst day of your family's life. My name is Dr. James Harlow. I've been a cardiac surgeon for over 17 years. I have held the human heart in my hands more times than I can count. I have seen what destroys it. I have seen what saves it. And what I've learned after nearly 2 decades in operating rooms and cardiac emergency units is this. The most dangerous moments in a person's day are rarely the ones that look dangerous. They're the ordinary ones, the invisible ones, the ones happening right now in bedrooms all across the world at the exact moment the alarm goes off. Let me explain what I mean. There is a window of time every single morning that cardiologists refer to as the morning danger zone. It's not a metaphor. It's a documented, measurable, scientifically established period of elevated cardiovascular risk that occurs in the first 1 to 2 hours after waking. Multiple large-scale studies have confirmed that the probability of suffering a serious cardiac event, a heart attack, a dangerous arrhythmia, sudden cardiac arrest, is dramatically higher during this window than at any other point in the day. Some research puts that increased risk at 40% above baseline. The National Heart, Lung, and Blood Institute has confirmed that the majority of heart attacks and cardiac arrests occur precisely during these early morning hours, 40%. Let that land for a moment. And the reason this window exists, the reason your body is so vulnerable in those first moments of the day, is not random. It's the result of a perfect physiological storm that your body triggers the instant you open your eyes. Here's what's actually happening inside you right now every morning while you're still half asleep. Your internal biological clock, your circadian rhythm, begins firing signals the moment it detects that you're waking up. The first thing it does is flood your bloodstream with hormones to prepare you for the demands of the day. The dominant hormone in that flood is cortisol. Cortisol gets a bad reputation as the stress hormone, but it serves a critical function. It tells your heart to beat faster. It tells your blood vessels to constrict. This causes a sharp, natural spike in blood pressure and heart rate. Completely normal, but significant. Your cardiovascular system goes from 0 to 60 while the engine is still cold. Simultaneously, your autonomic nervous system changes gears. During sleep, the parasympathetic system dominates, the rest and digest mode. The moment you wake, control shifts abruptly to the sympathetic system, the fight or flight mode. Adrenaline floods in, heart rate climbs, blood pressure rises further. Your heart is now demanding significantly more oxygen than it was getting 60 seconds ago, and it's doing this while it hasn't fully warmed up yet. Now add a third factor, one that almost nobody talks about and almost everyone ignores. Dehydration. After 7 or 8 hours of sleep, your body is in a state of mild but meaningful dehydration. You've been breathing, you've been sweating, you've lost fluid in a dozen small ways, and you've replaced none of it. The consequence of this is something called hemoconcentration. Your blood, which normally flows smoothly, becomes measurably thicker, more viscous. Think of the difference between water and syrup. Your heart, which is essentially a pump, now has to work dramatically harder to push that thicker blood through your entire circulatory system. And thick blood has another danger beyond the extra workload. It clots more easily. The platelets cluster together more readily. The risk of a thrombus forming is meaningfully elevated. So within the first few minutes of being awake, your heart is already facing 3 simultaneous challenges: a cortisol-driven spike in blood pressure, an adrenaline surge from the sympathetic system switching on, and the added burden of pumping dehydrated, thicker blood through vessels that haven't fully dilated yet. In a 25-year-old with elastic arteries and a strong heart, this is not a crisis. The body handles it without effort. You don't even notice it. But in a body that has been working for 60, 70, or 80 years, with arteries that have gradually lost their elasticity through a completely natural process called arteriosclerosis, this triple challenge is a genuinely dangerous situation. And it is precisely into this moment of maximum vulnerability that millions of people introduce a habit they believe is healthy. A habit that might be one of the most dangerous things a person over 60 can do. That habit is taking a cold shower first thing in the morning. I want to be careful here because cold showers have legitimate benefits that have been researched and documented. For young, healthy individuals with flexible cardiovascular systems, the body can adapt. But for an older adult whose heart and arteries are already navigating the morning danger zone, stepping under cold water the moment they get out of bed is the equivalent of dropping a match into a room that's already filling with gas. Let me tell you about a patient named Daniel, 69 years old, retired school teacher. He walked 3 miles every morning after his shower and had done so for 12 years. His annual checkups were nearly perfect, a cardiologist's ideal patient. His one morning ritual, the thing he swore by to wake himself up, was 2 minutes of cold water. Not cool, cold. He said it made him feel alive. One morning, 30 seconds into that cold shower, Daniel's wife heard a sound she'd never heard before. Not a crash, more like a collapse. She found him unconscious on the floor of the shower. He was in ventricular fibrillation. His heart wasn't beating. It was trembling, quivering chaotically, sending no blood to his brain, no blood to his lungs. If she hadn't been home that morning and called emergency services immediately, Daniel would not have survived. In the hospital, we found no significant blockages. His arteries were in remarkable shape for his age. The cause wasn't a clot. It wasn't a plaque rupture. It was the shock. Here is the precise physiological mechanism of what cold water does to an older body. The moment cold water contacts your skin, your body interprets it as a threat, a survival emergency. In response, it triggers something called massive peripheral vasoconstriction. Thousands of tiny blood vessels in your skin and extremities slam shut simultaneously in an attempt to preserve core body heat. It's as if someone suddenly closed thousands of valves in your circulatory plumbing all at once. Now think about this in terms of pressure. If you're forcing the same volume of blood through a system where thousands of outlets have just closed, what happens to the pressure in the main lines? It spikes. Research has shown that cold shock can raise systolic blood pressure by 20 to 30 points in a matter of seconds. For someone with already elevated baseline pressure, that spike is amplified further. For a heart that has been working for 7 decades, pushing blood through arteries that have less elasticity, less give, less capacity to absorb sudden pressure changes, this sudden spike is not a minor stress. It's the equivalent of trying to rapidly inflate an old, brittle rubber tube. The risk of rupture is not theoretical. In the human body, rupture means a plaque breaking loose from a coronary artery wall, causing a heart attack, or a vessel in the brain giving way, causing a stroke. And the danger compounds, because the heart, now fighting against this dramatically increased resistance, has to work harder and faster. Its own demand for oxygen skyrockets. If there is any underlying coronary disease, even mild, even asymptomatic, even the kind that would never have caused a problem under normal circumstances, the arteries may simply not be able to deliver the oxygen the heart suddenly needs. This oxygen debt destabilizes the heart's electrical system, and that's when arrhythmias appear. Dangerous ones. The most dangerous of all is ventricular fibrillation, the same thing that happened to Daniel. The heart's organized electrical rhythm breaks down completely. Instead of beating in coordinated pulses, it trembles, it vibrates, it does not pump. Without defibrillation within minutes, it is fatal. The cold shower didn't cause Daniel's heart disease. He didn't really have significant heart disease. The cold shower was the trigger that pushed a vulnerable system, already stressed by the morning cortisol surge, already burdened by dehydrated blood, past the point it could handle. Now I want to talk about something that almost no one ever connects to this picture. Something sitting quietly in medicine cabinets all over the world, prescribed by well-meaning doctors, taken faithfully by responsible patients, and silently making everything I just described more dangerous. Diuretics. Medications like furosemide and hydrochlorothiazide are among the most commonly prescribed drugs for high blood pressure in older adults. They work by helping the kidneys flush out excess salt and water, which lowers blood pressure effectively. Millions of people take them, and they work. But they have a side effect that is underappreciated, undermonitored, and in the context of the morning danger zone, potentially lethal. Diuretics deplete magnesium. Let me introduce you to Margaret, 76 years old, treated for hypertension for 11 years with a diuretic that had kept her blood pressure beautifully controlled. She came to my clinic complaining of occasional heart palpitations and leg cramps at night, symptoms her previous doctor had attributed to normal aging. Her electrocardiogram showed something subtle that caught my eye. Small changes in the electrical pattern that suggested her heart's electrical system was not as stable as it should be. I ordered a specific blood magnesium level. The result told me everything. She was significantly deficient. Her diuretic had been slowly, quietly draining the mineral that her heart needed most to maintain its electrical rhythm. Magnesium is not a supplement trend. In cardiac medicine, it is fundamental. It is the primary stabilizer of cardiac cell electrical activity. It regulates the flow of potassium and calcium, the ions that generate the electrical impulses that make your heart beat in an organized rhythm. When magnesium is depleted, cardiac cells become hyperexcitable. They fire erratically. They're unstable. The threshold for dangerous arrhythmias drops dramatically. Ventricular fibrillation becomes far more likely under stress. Now put the complete picture together. A 70-year-old taking a diuretic for a decade. Magnesium quietly depleted, heart electrically unstable without knowing it. They wake up. Cortisol and adrenaline surge, exciting the heart further. Their blood is thick from overnight dehydration, increasing cardiac workload. They sit up too fast, triggering a blood pressure drop and then a reactive surge. And then they walk into the shower and turn on the cold water. Each of these factors alone might be manageable. Together, in sequence, in a heart that is already electrically fragile, they create the perfect conditions for catastrophe. If you take a diuretic and you experience muscle cramps, nighttime spasms, or palpitations, do not dismiss these as aging. Speak to your doctor. Ask specifically about your magnesium levels. It is a simple blood test. It costs almost nothing, and it could reveal a hidden risk factor sitting right there in your prescription bottle. Now, I want to talk about one more danger that is responsible for countless hospital visits every year. One that seems so simple it barely feels worth mentioning until you understand what's actually happening inside the body when it occurs. Standing up too fast. When you've been lying down all night, your blood distributes itself relatively evenly throughout your body. The moment you stand up quickly, gravity immediately pulls up to a liter of blood downward, into the veins of your legs and abdomen. The blood that was available to be pumped to your brain is suddenly reduced. In a young person, pressure sensors in the blood vessels called baroreceptors detect this instantly and send an emergency signal to the brain, which immediately orders the heart to beat faster and the vessels to constrict, restoring brain blood flow within seconds. You never notice it. With age, this system slows down. Baroreceptors lose sensitivity. The heart's ability to respond quickly diminishes. The result is a window, sometimes just a few seconds, sometimes longer, where blood pressure drops and the brain is underperfused. You know the symptoms: dizziness, visual dimming, seeing spots. In the worst cases, syncope, a faint, and then a fall. Falls in older adults are not minor events. They are one of the leading causes of hospitalization, serious injury, and long-term decline. A hip fracture from a fall leads to surgery, immobility, blood clots, pneumonia, a cascade that kills far more people than the fall itself suggests it should. But the cardiac danger of standing up too fast goes beyond the fall. The body's delayed attempt to correct the blood pressure drop, when it finally kicks in, can produce a reactive tachycardia, a sudden, forceful, fast heartbeat that hits an already stressed heart like a second wave. Add that to cortisol, dehydration, and a magnesium-depleted electrical system, and you have a scenario of compounding risks that no single factor would create alone. So we have 4 distinct dangers: the morning cortisol and adrenaline surge, the dehydration that thickens the blood, the cold shower that spikes blood pressure violently, the rapid posture change that drops then spikes pressure again, and underlying all of it potentially, a magnesium deficiency created by the very medication prescribed to protect the heart. These are not rare, exotic medical scenarios. I see the consequences of this combination regularly. And the most important thing I can tell you is that preventing it requires almost nothing. No expensive equipment, no complex medication regimen, no dramatic lifestyle overhaul. It requires a 5-minute routine that costs nothing and could save everything. Here is what I call the 5-minute morning protocol, and I now recommend it to every patient over the age of 60 in my practice. The first minute is for conscious waking. When your alarm sounds, do not move. Stay exactly where you are. Take 5 slow, deliberate breaths. Inhale through your nose for a count of 4. Exhale through your mouth for a count of 6. This activates your parasympathetic system, gently signals to your body that there is no emergency, and begins to smooth the cortisol and adrenaline spike. It is the difference between a cold engine being floored and a cold engine being allowed to warm up. 1 minute, 5 breaths. It matters more than it sounds. The second minute is for hydration. Before you went to sleep last night, you placed a glass of room temperature water on your nightstand. Not cold, not hot. Room temperature. Now, from a seated position on the edge of your bed, not standing, seated, you drink that entire glass slowly. This single act begins reversing the hemo concentration. It starts thinning your blood. It gives your heart immediate relief from the thickened blood burden it woke up carrying. Of all 5 steps, this may be the one with the most direct, immediate cardiovascular impact. A glass of water. That's it. The third minute is for gravitational adjustment. You are now sitting on the edge of the bed with your feet on the floor. Stay there. Do not stand yet. This minute of seated pause allows your baroreceptors to recalibrate, your blood pressure to stabilize, and your body to prepare for the transition to upright posture. While you wait, move your ankles in gentle circles. This activates the calf muscle pump, one of the body's most important mechanisms for pushing venous blood back up toward the heart. 1 minute of ankle circles while seated does more for your morning circulation than you'd believe. The fourth minute is for gentle activation. Still seated, begin to move through slow, careful stretches. Gently roll your neck side to side. Lift your shoulders toward your ears and release them. Extend your arms above your head. Lean slightly forward from the hips. These movements increase circulation, send oxygenated blood to the muscles, and begin preparing the cardiovascular system for movement in a way that doesn't shock it. You are warming the engine before you drive. The fifth minute is for transition. Now, stand up, slowly, deliberately. Once upright, pause. Stand still for a few seconds. If you feel no dizziness, walk slowly toward your bathroom or kitchen. Do not rush. You have just moved from horizontal sleep to upright mobility in a way that gives your cardiovascular system time to adapt at every stage. You have respected the transition your body needs. Now, about the shower. This is not a recommendation to never feel cool water again. It is a recommendation to be intelligent about it. Begin with warm water, around body temperature, approximately 98 degrees Fahrenheit. Warm water gently dilates blood vessels, relaxes muscles, and creates no cardiovascular shock. If you enjoy the feeling of cooler water, you can work toward it, but gradually, not at the beginning of the shower, not with a blast of cold. After several minutes under warm water, if you feel well, you can reduce the temperature slowly. Always direct the water to your feet and legs first, then arms, then torso. If you choose to include very cold water at all, let it be brief, let it be at the end, and let it never hit your chest as the first sensation of the morning. If you have known heart disease, diagnosed coronary artery disease, a history of arrhythmia, heart failure, my clinical recommendation is unambiguous. Avoid cold showers entirely. The potential risk is not worth the claimed benefit. Your doctor's guidance supersedes mine, but that is my position as a cardiac surgeon who has treated the consequences. And listen to your body above all else. If at any point in your morning routine you feel chest tightness, unusual palpitations, significant dizziness, or shortness of breath, stop what you're doing. Sit down on the floor if you're in the shower. Do not try to push through it. Call for help if you need it. These symptoms are not normal aging. They are warning signals, and they deserve to be treated as such. Beyond the morning routine, the long-term protection of your heart requires conversations with your doctor that many people never have. If you are over 60, have high blood pressure, and take a diuretic, ask specifically about your magnesium levels the next time you see your physician. It is a simple addition to a standard blood panel. If your magnesium is low, supplementation, always under medical supervision, can meaningfully reduce your arrhythmia risk. Do not self-supplement based on this video, but do ask the question, know your blood pressure numbers. Not just during clinic visits, where white coat anxiety can distort the reading, but at home, in your normal morning state. For most adults between 65 and 79, the target is below 130/80. A home blood pressure monitor is one of the most valuable cardiovascular tools available to a person of any age. And do not let this video make you afraid of morning exercise. The evidence is clear and consistent. Morning physical activity, once your body has been properly prepared, is among the most protective things you can do for your heart. Studies from the European Society of Cardiology have shown that exercising between 8 and 11 in the morning is associated with the lowest risk of heart disease and stroke. A brisk walk, gentle yoga, a stationary bike, these are powerful medicine. The key is sequence. Preparation first, movement after. Not movement into a cold, dehydrated, cortisol-flooded system without a transition. Thomas, the patient I told you about at the beginning, the one who collapsed on an ordinary Tuesday morning, made a full recovery. He is 76 now. He walks 2 miles every morning. He has never missed a day of his 5-minute protocol since leaving the hospital. He told me once, sitting in my office for a follow-up, that the 5 minutes felt like nothing when he started. Now, he said, they feel like the most important 5 minutes of his day. He wasn't wrong. The heart is not fragile. It is extraordinary. An organ that beats roughly 100,000 times every single day without you asking it to, without you thinking about it, without it ever stopping to rest. But it is not invincible. And in older age, the margin between manageable stress and dangerous stress narrows. The transitions matter. The moments of greatest physiological change, sleep to waking, lying to standing, cool to cold, are the moments that require the most respect. Caring for your heart is not about heroic sacrifice. It is not about perfect discipline or complicated routines. It is about understanding what is actually happening inside your body during the ordinary moments of your day, and making small, intelligent choices that give your most vital organ the environment it needs to keep doing what it has always done. Protecting that is not just self-care. It is the most concrete act of love you can offer to every person who depends on you being here tomorrow. If someone you know is over 60, a parent, a grandparent, a close friend, please share this with them today. Not because it is alarming, but because it is actionable. Because the difference between a dangerous morning and a safe one could genuinely be a glass of water and 5 minutes of patience. Take care of your heart. It has never once stopped taking care of you.